Would you let your healthy dog have surgery to prevent a disease that they may never get? I know it sounds extreme, but until you realize that one breed has nearly a 40% lifetime risk of developing one of the deadliest surgical emergencies in veterinary medicine. And we're talking about GDV. GDV stands for gastric dilatation volvulus, what a lot of people call bloat. The stomach can either twist and then fill with gas, or it can fill with gas and then twist. It's the twist that cuts off the blood flow to the stomach. It can drag the spleen with it. It compresses the large veins in the abdomen that return blood flow to the heart. This rapidly sends dogs into shock. Without surgery, GDV is almost always fatal. But how common is it? And here's where the story gets really interesting. Not every dog has the same risk. You've got breed risks, so Great Danes have about a 35 to 40% lifetime risk. Irish Wolfhounds, 20 to 30%. Then you've got the St. Bernards and the Weimaraners, the Standard Poodles, German Shepherds, Dobies, and Gordon Setters. These dogs all have one thing in common: a deep, narrow chest. But what about small dogs? Here's something many people don't realize. Small dogs can absolutely develop GDV. I've personally operated on Basset Hounds and Chihuahuas and miniature Schnauzers and Dachshunds and Shih Tzus and Bostons and even a Jack Russell with a gastric torsion. But compared with giant breeds, it's really uncommon. In fact, most studies show that small and toy breed dogs have a well under 1% lifetime risk of GDV, although the risk does increase as they age if they have an unusually deep chest. But that's why we don't generally recommend preventive gastropexy for the average small dog. We really save that for these large and giant breed dogs. The potential benefit simply doesn't outweigh the risks of the surgery. So, who's at risk besides these specific breeds? Larger giant breed dogs with deep chests, older age, a close relative that has a history of GDV, dogs that eat one large meal a day, dogs that eat very rapidly, nervous and anxious temperament dogs, and previous episodes of gastric distension or dilation. So what's a prophylactic gastropexy? Well, this is a preventative surgery where we permanently attach the right side of the stomach to the abdominal wall so that it can't twist. Now, here's the important part. This does not stop bloat. It doesn't stop the stomach from distending with gas. What it prevents is the stomach from twisting, and that is the dangerous part. And that's the part that usually kills dogs. Does it work? Absolutely. An elective gastropexy is one of the most effective preventative surgeries that we perform in veterinary medicine. Studies show that it reduces the risk of gastric volvulus to nearly zero in dogs that receive a properly performed gastropexy. Well, when should it be done then? And the ideal time, in my opinion, is when your dog's already undergoing anesthesia. For example, during its spay or neuter, during another abdominal surgery, or if you have it scheduled as an elective laparoscopic procedure. Adding a gastropexy to a planned surgery is usually much easier and much safer and much cheaper than performing an emergency surgery at 2 in the morning. So what are the risks? Well, no surgery is risk-free. There are potential complications. They include infection, bleeding, incision problems, rare failure of the stomach actually attaching to the body wall. But fortunately, complication rates are really low in otherwise healthy dogs undergoing elective surgery. The bottom line for me, should every dog get a preventative gastropexy? No. For the average Chihuahua or Cavalier King Charles Spaniels, probably not. But a Great Dane, an Irish Wolfhound, another high-risk, deep-chested breed, it may be one of the most life-saving elective procedures in veterinary medicine. Sometimes the best emergency surgery is the one that your dog never needs. Follow me for more evidence-based veterinary medicine.